What are the types of hematomas you can get after surgery? Have you ever wondered what happens when blood leaks out of vessels after surgery? This situation can lead to a hematoma, which is a collection of blood outside of blood vessels. Hematomas can develop in various forms depending on where they occur and how severe they are. Let's break down the different types of hematomas you might encounter after surgery. First, there is the subcutaneous hematoma. This type forms just beneath the skin near the surgical site. You may notice swelling, bruising, or a tender lump in this area. While these are often small and resolve on their own, they can sometimes cause discomfort or delay healing. Next, we have the deep tissue hematoma. These occur deeper in the tissues or muscles surrounding the surgical area. They can cause noticeable swelling and pain. If they are large or pressing on nearby structures, they may require medical attention. Then, there are intracranial or epidural hematomas. These types are rare but can occur after brain or spinal surgeries. An epidural hematoma forms between the skull and the brain's outer lining, while a subdural hematoma develops between the brain surface and its lining, both requiring urgent treatment due to their seriousness. Another type is the retroperitoneal hematoma. This occurs deep inside the abdominal cavity but outside the organs. It can happen after abdominal or pelvic surgeries and may lead to abdominal pain or signs of internal bleeding. Organ-specific hematomas can also develop. These occur inside organs affected by surgery, such as the spleen or liver. The severity can vary based on the trauma during surgery. Lastly, there is the septal hematoma, which develops in the nasal septum after nasal surgery or trauma. This can cause nasal blockage and needs prompt treatment to avoid complications. Hematomas can also be classified based on when the bleeding occurs. Primary bleeding happens during surgery and is usually controlled before closing the wound. Reactive bleeding occurs within 24 hours post-surgery, often due to slipped ligatures or missed vessels. Secondary bleeding can happen days later, usually between 7 to 10 days, sometimes due to infection. Certain factors can increase the risk of developing a hematoma after surgery. These include the use of blood thinners, bleeding disorders, vigorous physical activity, coughing, high blood pressure, or trauma to the surgical site. Hematomas can raise the risk of infection and may need treatment like drainage or additional surgery if they are large or causing complications. If you notice unusual swelling, increasing pain, bruising, or drainage from your wound after surgery, it is important to contact your healthcare provider promptly. Early recognition and management can help prevent further complications and support proper healing.